All right, today we are back for our third Smooth Threads treatment. We are using Smooth Threads to treat this particular patient sort of in this lower face area. She also has a little bit of acne scarring that we've been targeting as well. This is her third of 3 treatments, and we use the V-Soft Lift 29 gauge by 30 millimeter twisted thread. And we're just trying to sort of strengthen this area. She's come a long way. We do these treatments for her. We do generally about 2 rounds a year, so about every 6 months we repeat these treatments for her. She has already been cleansed. She's been numbed for 10 minutes with a topical anesthesia. You will notice she has a couple of active blemishes. We will do our best to avoid those. You never want to pass a needle through an active blemish because of the risk of potentially contaminating other areas and spreading that bacteria. So I'm going to get, a little fancy maneuvering around some of these active blemishes that she has. If she had like a more widespread acne that covered the entire area for sure, I probably would recommend that she returns on another day to do it. But given that they're just sort of localized, I feel like we're able to work around it. So I'm just going to mark her up. The good news about Smooth Threads is there's really no right or wrong. When you think about placing Smooth Threads, what this is going to do is stimulate collagen and elastin. And so you're thinking of creating like a scaffolding or a mesh of where you're trying to treat. So, the treatment plan I use might be different than the treatment plan you would use, and that's totally fine. We stimulate collagen about 1.5 millimeters from where our threads are placed. And so you want to have them close enough that you're going to get nice, even collagen stimulation from where you're placing your threads. So a lot of times you'll see us use sort of like a hash mark or a hashtag, whatever, just to create that sort of like really solid foundation for that collagen to stimulate and support this area. So I'm going to go ahead and lay her down. I like for Smooth Threads, I just find it's more comfortable when she's laying. The key with Smooth Threads is that you're holding that tissue really tight, especially in an area where the face is sort of changing. There's a lot of contour changes in this lower area of the face, and you want to keep a very flat area to work. You'll find things just sort of glide nice and easy when the skin is pulled tight. Doing okay?
Mm-hmm.
So we are using a twisted thread. The thread is literally twisted around the needle. And she's going to bruise right here. She got a little hematoma. So these do require a little bit more of a push once that thread meets the tissue, the twisted portion of the thread. Sorry, you doing okay?
Yeah.
Once this comes out, you can see she's got a little tiny bulge. That's going to be a little bruise for her. We've done these treatments on her quite a bit, and sometimes she gets bruising and sometimes she doesn't. There's a lot of different factors that we know that can cause bruising with aesthetic treatments. Any sort of blood thinning medications, if they've taken any anti-inflammatories recently, fish oils, vitamin E, all of those, even supplements can cause bruising. Alcohol certainly can cause bruising. Any alcohol intake within the last 24-48 hours, alcohol thins the blood and can increase the risk of a hematoma as well. And sometimes they can do all of the right things and it still happens. We're putting needles into an incredibly vascular face, and sometimes it's unavoidable. So we'll put some pressure on here and give her an ice pack. She can start taking some arnica. That will help resolve the bruising. if I ever have this happen, I will just give it like a little bit of pressure and massage just to try and get that pocket to reabsorb. Doing okay? Mm-hmm. Clean her up. It doesn't look terrible, but I do know, like, I just know her as a patient, and I know that that's gonna leave a little bit of a bruise. Okay, we're gonna move on to the other side of her face. Turn away from me just a little bit, thank you. So again, I'm just sort of placing these threads where I've marked these lines. You don't actually, if you decide mid-treatment you want to change your lines, that's fine too. I always say you're never really married to these lines. If they work for you, great. If you'd like to change them, go for it. I'm just cross-hatching here, and then she'll be all done. And then we will reevaluate her in about 3 to 6 months and decide if she wants to repeat. The smooth threads, you could do, a lot of providers will do 3 treatments and then give the patient a break for that 3 to 6 months mark. That's when we expect to see the most collagen stimulation. Other providers will treat monthly until they see the results that they're going for. So they would literally treat for, say it takes 6 months to see results, they might treat for 6 months straight. Everybody does it a little bit differently, but there's certainly no harm in treating until you get the result that you're looking for. Okay, so she's clean. Like I said, I'll give her an ice pack for that other side just to help with that bruising. And then we'll reevaluate her in about 3 to 6 months and go from there.